easier said than done. Even if you know how to boost your immune system, a lot of us, for some reason, just can't do it for different reasons. Uh, how much is the cost of the drop bottle? I'll leave that to the marketing team. Can we combine with drugs prescription? Yes, this is just food. Essential oils. It has no known interaction with other drugs. Just imagine, can you eat salad or pinakbet or chop suey while you're taking your medicines? It's basically the same principle. Bakit hindi po natin i-recommenda sa government para makatulong tayo sa maraming tao? Kung may way po kayo to recommend to the government, push po natin yan. But as I said po, and when I start my talk, that's not my thing. My approach is not to go to the government directly, because from what we've seen, the basis for their decisions are not just science, but also politics and economics. And science lang yung alam ko. Okay? What I prefer to do is to let people, as many people as I can, let them know of the information, and then let them demand sa government. Okay? With people taking maintenance medicine, yes, it's okay. Remember, this is food supplement. This is not a drug. So the chances of it interacting with your maintenance medications is very low or negligible. Can we apply the autoimmune in pressure ulcer? Maybe not, because that's not the form that's for it. There's another one, the soft gel capsules, because the essential oils, they taste really bad. Okay. Now, to make it palatable, we added something sweet, something like honey, so it will taste nice. And honey has sugar, and if you have pressure sores, you don't want sugar there, because sugar has okay. May I just ask everyone, if you're not really here, to just turn off your video so we won't see what's going on in your private whatever. Anyway, so you don't want to put that on your pressure source, because that has sugar, and sugar is the food of bacteria. So it might do more harm than good. But we have there's a different formulation minus the sugar. It comes in capsule form. That might, that will do better. But for this product, no. Open wound, same thing, no. It's meant to be ingested. It's not meant to be applied on wounds. Okay. No need for vaccinations. Well, that's debatable, because right now there is nothing that offers 100% protection. Okay. So you want to have as many items as you can that will add up for you to eventually reduce your risk to a minimum number. For those already infected with COVID, how much is the dosage? And okay, for those infected with COVID, this might not be enough, because it works mainly on the throat. And the COVID symptoms, if you're already positive, the virus is already systemic. Okay? It might not be enough even if you drink the whole bottle. There's a different formulation for that, which is not this. So you cannot rely on just this for COVID patients. It will be very good. It will do a lot of help if you give it coinciding with the other things for treatment, like your vitamin C, zinc, your vitamin D, azithromycin, all those things that the doctors prescribe. But it cannot be just this. Pwede din po ba i-recommend sa may mga prostate cancer? Well, yes, but it won't, it's not bad. But as to would it help them with the prostate cancer? Maybe not. They're totally different. Okay. What it can help them with is to not add problems to the prostate cancer anymore by preventing you from getting more viral infection. Is it better to take with empty stomach or after meals? Ideally, you want to take this before meals, so absorption would be better. But If it causes stomach upset, you might want to take it after meals. Any other questions? Sa mga may tumor, ilang drops po ang pwede nila i-take every day? Hindi po siya para sa tumor. It's mostly for your protection po, prevention from getting the infection. But if a person already has tumor, this is not the right supplement for that. It can help by not aggravating the situation, as I said. So it will prevent further infection, but it will not address the tumor. So how much will you take? Well, you take what's recommended. A dropper full 3 times a day, or maybe more. But I wouldn't say that it can help the tumor. Not with this amount, not with this preparation. Pwede rin po ba sa mga bata? We usually limit it to 7 years old. So for 7 and below, we don't recommend it. Not because it's not safe, but because we don't know. We don't have studies for kids. Okay, it's usually the adults. So we don't recommend because we don't know if it's safe. Chances are it is, but we can't really guarantee that because there are no studies. How to avail of the product abroad? Miss Arlene will take care of that. Okay. Pwede po ba sa may shingles? Yes, pwede po. Okay. Anything else? Questions from the audience? Sir Chris?
Hello po. Yes po, baka may mga questions pa po kayo.
May I ask about Resvir? What's Resvir? Remdesivir? Okay, maybe this is not the right platform for that. You can look for me on FB. You can ask me there. Pwede po ba siya i-take pag may autoimmune disease? Yes. If you remember the third part of the properties of the ingredients of autoimmune, it says it's anti-inflammatory and immune regulator. So it can help with autoimmune diseases. It will lessen the flare-ups. But then autoimmune disease is a complex problem. So this can just help a little, but it's not the main thing for that. Okay. Again, its strength is in protecting you from viral and bacterial infection with entrance in the nasopharynx. Okay. For other diseases, it might not be as effective. It's mostly for prevention. Can we have the recording? Okay. So please take care of that. Anything else? Pwede ba sa may gout? Yes. In fact, remember, gout is an inflammation. And the ingredients of autoimmune have anti-inflammatory properties. We have patients taking this formulation who have been on it for 3-4 months and for prevention, but then they notice that their symptoms of gout, the pain in the knees and the joints, have subsided. So we know it will work. Maybe not as fast as your medicines, but eventually it will help. It just takes longer. Sinus, well, it can work both ways. For if you have sinus problems, one, the anti-inflammatory ingredient can help reduce the inflammation and stop the sinusitis. But then depends on your individual makeup. It might also be an irritant in itself, so it might aggravate your sinusitis. The best way, I guess, is to just see if it works for you. If it works for you, well and good. If not, then maybe we can look for something else. Okay. Anything else? Sige. Magtitigan muna tayo dito.
Sino pa po may mga questions?
Huwag niyo po ako masyadong titigan, ako conscious ako. Sino? Ano pa ba yung... Sige,
ako po, Abs Chris.
Yes po.
I have one parent who has shared with me that her uncle is suffering from what's this? Bleeding in the poo. You can understand that. Nagbi-bleeding siya sa poo. And so when he started taking the autoimmune, the blood in the poo stops and the color of the skin became normal. So do you think it has something to do with taking the autoimmune?
Well, yes, of course it has helped. It's a long way because that's the other end of the whole. Meaning we're one continuous channel from the mouth to the anus. But when in some cases, depending on how you take it and depending on how your body metabolizes it, you can actually absorb the essential oils from the mouth, from the throat cavity. Remember, there are sublingual drugs. You absorb them under the tongue. So even the essential oils of autoimmune can also help with that. Then maybe the dose that he's taking is just enough to help that. That problem, I think it's it's probably hemorrhoids. So basically, that's due to weak blood vessels, inflammation, some infection. So all those things, the ingredients of autoimmune have a little help for those. So because with essential oils, as you notice, they have a lot of functions. Unlike drugs that you have one drug, one disease. For essential oils, it's different. One essential oil can work on a lot of diseases. So even if we're using it for prevention, for infection, because it can do other things, it can help with other problems. We can't just tell you that now because we don't know. It will really depend on how your body accepts the essential oils. But it's not surprising if you have diseases that resolve by using this product. Actually, it's worth a try if you think na, nothing to lose here. If you've been on that problem for years and your medications don't help or the doctors have given up on that, then maybe you can try this. If it works, then share the good news. Yeah, so I think that was a help. Can this be taken for people who are recovering from surgeries? Yes. One problem you have after surgery is infection of the wound. So by arming yourself with things that fight infection, then you have a better edge in faster recovery and wound healing. Again, for surgery, it's good to take this orally, but don't apply it on the wound itself. Yes. Can this be taken by diabetics, hypertensives? Yes. There are no contraindications. If you have maintenance, you can take it, no problem. Precaution for lactating and pregnant women. We can't recommend it, again, not because it's not effective or safe, but because we don't know. Okay. We don't have studies on that. So we don't know if it's safe. It may be, it might not be, but we're not risking that. Anything else? People undergoing dialysis, okay, that's a little tricky. You might want to discuss that with your doctor in charge of the dialysis, because different people have different composition, different reasons why they have those problems. So consult with the doctor first, because although it might not be a problem, it's just a little, it can probably help. Because if you're on dialysis, your immune system is compromised, you're more prone to infection. So the essential oils of Alpha Immune can help a lot. But just so your doctors are aware, because it might interfere or interact with what other programs is doing, just let them know. Okay. Anything else? Hmm.
Thank you very much, Doc, for a very clear explanations and answers to our questions. Yan. Big clap po.
You're always